Good evening, good afternoon, good morning, depending on where you're listening to me from. I am Dr. Quigieng, and today I want us to talk about sciatica. Sciatica, I'm sure it's a word you have heard before, but what is sciatica? People usually refer to it as if it is a disease. First point, sciatica is not a disease, it is a symptom. It's not a disease, it is a symptom. It's a symptom that is indicating that there is a problem somewhere in the body. But what is this symptom called sciatica? It is pain in the lower back or in the entire lower limb, which presents as a burning pain, an electric discharge like pain, or heaviness of the limb starting in the lower back, moving into the buttocks, going down into the thigh, leg, and foot, and usually ending in the toes. So it is pain that has a well-defined trajectory, a well-defined path that corresponds to the innervation of the sciatic nerve. It could be burning in sensation, it could be current-like in sensation, it could be heavy-like in sensation. It is usually worsened with coughing or bending and relieved with rest. That is sciatica. So if you experience pain on your lower back or your lower limb, which is usually unilateral, that is, it affects one side, it will affect both, but it is rare, and it fits the characteristic that I just described, you probably have sciatica. What is sciatica? We have just covered it. What causes sciatica? It is very important to know, because if you experience something, it means that there's something that causes it. So we could put it in two big classes: mechanical causes and inflammatory causes. We are going to make the list short because there are many of them, but I will mention the commonest. The first one in the mechanical class is herniated disc. At the level of your spine, you have bones separated by intervertebral disc, and it may happen that this disc bulge or herniate, applying pressure on the nerve. And if it applies pressure on the nerve roots of the sciatic nerve, you're going to experience pain along the course of that nerve. So that is the first cause. The second cause in the mechanical class will be called vertebral body misalignment, what we call in medicine spondylolisthesis. So your vertebrae, which are normally like this, will slip, and in the slipping movement, bone will press against the nerve and give rise to the pain. And in the inflammatory classes, we will mention compression or inflammation of the piriformis muscle. The piriformis muscle is a muscle that attaches your femur to your pelvis, and usually the sciatic nerve passes beneath or through this muscle. So if the muscle becomes inflamed, if it becomes tense or stiff, it's going to irritate the nerve and causing the sciatica pain. We have covered what it is, we have covered what causes it. If you experience sciatica, what to do? Rush to your doctor. You are fortunate today in 2023, you may avoid the long queue in the hospital, you may avoid waking up early to come and pick a ticket quite fast to meet the doctor. You have online, you have digital platforms to meet your doctor today, like the one on which you're listening to me or I speak to. Get to your doctor, explain your symptom to him, and he's going to tell you what to do in order to identify the cause. And this is very important. I stress on it. As a patient, if you experience sciatica and you go to a doctor, it is your right to know what causes the pain, because when you know what causes the pain, you know how to go about to treat and to prevent recurrence. So you meet your doctor, he will check you, he will do some tests and identify the cause and gives you appropriate treatment. Treatment could be medical or non-medical. Medical will involve the use of tablets, pain medicine, or non-medical with the use of weight loss, because if you're obese, if you're overweight, you apply extra pressure on your bones and indirectly on the nerves, and also stretches if the cause of the irritation of the nerve is the piriformis muscle. Piriformis muscle stretch are going to help relieve the pain. Thank you for listening to me. This was Sciatica, and see you next time for another education.